Okay, we're gonna take a look now at the AC joint. Sometimes people have a hard time finding it, so what I can usually do is I palpate here the ventral side of the clavicula, and I go further, and here I have the ventral side of the acromion. So here I can actually, there I can notice the joint space, so I know that the joint space is more or less here. What usually happens is that people scan too far forward, too far backwards. So what I sometimes do, I take my right hand, I place it here, so this prevents me from going too far forward. So now I place the probe almost in the, well, almost directly from the top. I put it on, and then I move it a bit forwards against my finger, and then you already have the image on the screen that you're looking for. Yeah? So here we have on the left, we have the clavicle. Let me see if I can scan that for you like this. You see the clavicle comes up here. This is the head of the clavicle laterally. We go a bit more lateral, which is the joint space, and this of course is the acromion. Things to look for is this, the width of the joint space. We can actually see some sound waves going through, and below here, this is the supraspinatus tendon. I think with him, if we do a little bit of a dynamic movement like this, let's see, yeah, if you now look at the screen, you see deep down there, you see something moving. We're looking at the supraspinatus tendon. We're looking at it with through a little keyhole. You see it moving right down here. Yeah. So in this case we can look through, so that means there's no real joint space narrowing. That's a good sign. On top we have the we call this the ligaments, the capsule. The capsule should be almost straight going over it. This actually looks a little bit thickened, but you know, it can be just an incidental finding. There's no spurs here, no spurs here, so no osteophytes. If you are doubting if this is causing any issues, you can put the Doppler on, because if it's a symptomatic AC joint, in case of any arthritis, you should see some neovascularity, hypervascularity right in these structures, but now that is not the case. You can also do some dynamic maneuvers. For instance, you ask the patient to do this, they make a fist, and then I'm going to ask him to strongly push my hand, and then he relaxes again. You relax, let your arm fall. Yeah, so now here we have the joint space in a relaxed position. Now it's going to push, and you see the joint space narrowing just a little bit, and he relaxes again and it's open. But yeah, and you can of course do the piano key. So I'm pushing on his clavicle now, but you almost don't see any movement in the image. So this looks like a pretty stable joint in this case. Yeah, and that's all there is.